Welcome back to our Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for detail of this channel visit the bio section, or you can also check out my first video. Sorry if there is any mistake in videos or shorts. Today we will discuss the tooth movement. You all have wondered why we need to know and learn about this. Because it helps predict when and how baby teeth will be replaced by permanent teeth, ensuring timely interventions if needed, aids in planning effective orthodontic treatments, helps maintain overall oral health by preventing issues like crowding, misalignment, and improper bite. Because by this topic, you will know what are the changes occur before, during, and after the eruption. First, what is eruption? Eruption derived from the Latin word erupere, means to break out, basically cutting off the tooth through the gum. The emergence of the tooth through the gingiva is the first clinical sign of eruption. Important for MCQ. There are two main definitions of eruption. First, Maury, Messler and Score in 1941 defined eruption as the process whereby the forming tooth migrates from its intraosseous location in the jaw to its functional position within the oral cavity. James K. Avery defined eruption as the movement of the teeth through the bone of the jaws and the oling appear and function in the oral cavity. First, you have to understand that here the tooth movement is in context of eruption. Tooth movement occur for eruption of the teeth from the jaw to oral cavity, also maintain its position during expansion of the jaw, which occur in some period of life. The process of a tooth moving into its correct position in the mouth start as soon as the root begins to form, because this time tooth starts to migrate into the oral cavity as well as jaw expands, so maintain its position. These occur before the tooth become visible in the oral cavity. When you answer the question, they don't want to know the story, they just want important points, so you have to write neat, clean and clarified answers. Pattern of tooth movement. Movements leading to eruption of the tooth can be divided into the three phases. Phase 1, pre-eruptive phase. Phase 2, pre-functional eruptive or eruptive phase. Phase 3, functional eruptive or post-eruptive phase. Starting with the pre-eruptive phase. The pre-eruptive phase begins after the tooth germ has formed and continues until the initiation of the root formation. During this phase, the tooth germ undergoes significant movement within the jaw to accommodate the growth of the jaws and ensure proper alignment of the future eruption. Here, the tooth germ, also known as a tooth bud, is the embryonic structure from which a tooth develops. There are two primary type of movements during the pre-eruptive phases. One is bodily movement and the eccentric growth. Bodily movement. This movement involves the entire tooth germ shifting within the jaw. It occurs continuously as the jaw grows. Bodily movement is facilitated by bone resorption in the direction of the tooth movement and bone opposition behind it. These ensure that the tooth germ maintains its position relative to expanding jaw. Bodily movement is crucial for accommodating the increasing size of the jaws and ensuring that the tooth germ is correctly positioned for the future eruption. As the jaw expands, the tooth germ has to maintain its position, and for that, osteoclasts attach to the bone surface and secrete acids and enzymes that dissolve the bone minerals and break down the bone matrix. This resorbed bone is then removed by osteoclast, creating a pathway for the tooth germ to maintain its position even after the expansion of the jaw. Same in bone opposition, that the osteoblasts produce the new bone matrix which eventually become mineralized to form new bone, and this new bone provides structural support and helps maintain the tooth germ's new position relative to expanding jaw. Coming to the eccentric growth. Eccentric growth refers to the relative growth in one part of the tooth while the rest of the tooth remains constant. For example, the root of the tooth elongates while the crown does not increase in size. The crown maintains a constant relationship with the surrounding alveolar bone, and the increase in alveolar height compensates for the root growth. Eccentric growth ensures that the tooth germ maintains its proper orientation and position within the jaw as it develops. So visualize a tooth germ where only a specific part is growing while the rest remain unchanged. The root of the tooth elongates while the crown stays the same size. As the root grows downwards, the surrounding bones adapt by increasing in height to accommodate roots growth. During the pre-eruptive phase, the position of the developing tooth germ changes significantly. Successional permanent teeth. These teeth develop lingually and near the occlusal level of the primary predecessors. Predecessors are the primary teeth that erupt first in the child's mouth, and successors are the permanent teeth that replace the primary teeth. And by the end of the pre-eruptive phase, they are positioned lingually and near the apical third of the primary anterior teeth. This change in the position is mainly due to the eruption of the primary teeth and the coincident increase in the height of the supporting tissue. We already know that during the eccentric growth, the surrounding tissue and the bone increase their height. Permanent molars, unlike successional permanent teeth, permanent molars do not have primary predecessors. They develop without the same positional relationship and are influenced more by the overall growth of the jaws. The pre-eruptive phase is influenced by both genetic and environmental factors. Genetic factors play a significant role in determining the timing and the pattern of the tooth movement. Family history can often predict eruption patterns and potential dental issues. Environmental factors, nutrition, health conditions, and habits such as a thumb sucking can also affect the development and movement of the tooth germs. Habits we'll discuss later. Coming to the eruptive stage, the eruptive phase of the tooth movement begins within the initiation of the root formation and ends when the tooth reaches occlusal contact. This phase is crucial for positioning the tooth correctly in the dental arch. The process involves multiple anatomic stages and significant changes in the surrounding tissue. So, anatomic stages of the tooth eruption given by Noyes and Score. Stage 1 is the preparatory stage, which is opening of the bony crypt. The eruptive phase begins with the formation of a space in the bone where the tooth will develop. Stage 2, migration of the tooth towards the oral epithelium. The tooth moves through the bone towards the oral epithelium, and the migration is facilitated by bone remodeling and the activity of the periodontal ligament. Bone remodeling is a continuous process where old bone tissue is replaced by the new bone tissue. Stage 3, emergence of crown tip into the oral cavity because of the migration. Stage 5, first occlusal contact. The tooth make it first contact with the opposing teeth in the dental arch. Stage 5 is full occlusal contact. The tooth continue to erupt until it reaches full occlusal contact with the opposing teeth, ensuring proper alignment and function. And stage 6, continuous eruption. Even after reaching occlusal contact, the tooth continue to erupt slightly to compensate for occlusal wear and ensure continued function. During the eruptive stage, there are some changes in the tissue overlaying, surrounding, and underlying the teeth. So the changes in the tissue overlaying the teeth. So first is the alteration of connective tissue. The connective tissue in the dental follicle changes to form a pathway for the erupting tooth. Histologically, the future eruption pathway appears as a zone with the decrease and degenerated connective tissue. Here there is a decrease and degenerated connective tissue, fibers, cells, blood vessels, and terminal nerves. These changes are due to the loss of blood supply and then release of enzyme that aid in the degradation of the tissue. And these altered tissue space overlaying the tooth become visible as an inverted funnel shape. There is inverted funnel shape structure called the cubernacular cord guiding the tooth in its eruptive movements. Then bone resorption. Osteoclast resorb a portion of the bony crypt and overlaying the erupting tooth, allowing the tooth to move through the bone. The eruption pathway initially small, increasing in dimension to accommodate the erupting tooth. Contact with oral mucosa. When the tooth nears the oral mucosa, the reduced enamel epitheliums come into the contact with the overlaying mucosa. The reduced enamel epithelium is a layer of cells that cover the developing tooth, and these covering contact the oral mucosa, and these oral epithelial cells proliferate and fuse into the one membrane, forming a pathway for the tooth. Then blanching of the mucosa. Further movement of the tooth stretches and thins the membrane over the crown tip, causing the mucosa to become blanched due to the lack of the blood supply. Adjustment and eruption. The tooth remains stationary for a few days and then continues to erupt, allowing supporting tissue to adjust to the movement. And each eruption movements result in more of the crown appearing in the cavity and further separation of the attachment epithelium from the enamel surface. So as the tooth moves upward, it pushes against overlaying tissue, and these movements stretches the membrane covering the crown tip of the tooth. This stretching causes the membrane to become thinner over time. The thinning membrane exert pressure on the mucosa, which is the soft tissue lining of the mouth above it. This pressure reduces the blood supply to the mucosa in the specific area, and due to decreased blood supply, the mucosa appears blanched or paler than the surrounding tissue. These are the changes occur in the tissue overlaying the teeth, which include degradation of the connective tissue to the formation of the canal and merging of the reduced enamel epithelium and oral mucosa, and thinning of the tissue and blanching of the mucosa for emergence of the teeth. Changes in the tissue around the teeth. The connective tissue. Initially, the dental follicle is composed of delicate connective tissue, and as eruptive movements commences, collagen fibers become prominent, extending between the forming note and the alveolar bone surface. Collagen fibers basically form the note. As they become prominent, these fibers reach out towards the alveolar bone surface, creating a network of connective tissues, and the extending collagen fiber connect the forming note to the alveolar bone surface, and this connection helps stabilize the tooth and provide the necessary support during the eruption process. Then periodontal fiber bundles. So the first noticeable fiber bundles appear at the cervical area of the root, extending coronally to the alveolar process. The alveolar bone of the crypt is remodeled to conform the smaller root diameter. As the eruption processed, collagen fiber bundle become visible along the forming root, populated with the fibroblast and myofibroblasts. Periodontal fibers attach to the root surface and alveolar bone, stabilizing the tooth during eruption. Then alveolar bone remodeling. Continuous remodeling of the alveolar bone ensures that the tooth can move occlusally, increasing in height and changing shape to accommodate the crown. Then changes in the tissue underlying the teeth. The first is a follicular tissue. Changes occurs in the soft tissue and fundic bone, which is the bone surrounding the apex of the root. Space is provided for the root to lengthen as the crown moves occlusally and the height of the alveolar bone increases. Then fundic area changes. Fine bone trabeculae appear in the fundic area, compensating for the tooth eruption and providing support as the apical tissue. This structure described a bony ladder become denser as alternative layer of the bone plates and connective tissue are laid down. Then occlusal and root completion. So at the end of the pre-functional eruptive phase, when the tooth comes into occlusion, about 1/3 of the enamel remains covered by the gingiva and the root is incomplete. Root completion continues for 1 to 1.5 years in the deciduous teeth and 2 to 3 years in permanent teeth. Then coming to the post-eruptive phase, this post-eruptive phase begins when the teeth reach occlusion and continues as long as each tooth remains in the oral cavity, and this phase involves the several significant changes and adaptation in the teeth and surrounding structures. The first change is alveolar process and root growth. The alveolar process increasing in height and the root continues to grow. Teeth move occlusally towards the chewing surface to accommodate the jaw growth and allow for the root elongation. Then changes at the occlusion. Once occlusion is established, alveolar bone density increase. Principal fibers of the periodontal ligament establish themselves into separate groups around the gingival third alveolar crest and the alveolar surface around the root. Fiber bundle diameter. The diameter of the pedial fiber bundle increases from delicate fine groups of fiber to the heavier securely stabilized bundles. Then adhesion and occlusal wear. Over time, adhesion occur wearing down the occlusal surface. Teeth erupt slightly to compensate for the loss of the tooth structure and to prevent overclosure. If occlusal wear is excessive, cementum is deposited on the apical third of the root to compensate for over eruption of the teeth. Bone apposition occurs at the alveolar crest. Then mesial drift. This term refers to the slightly forward movement of the teeth. Mesial drift result in the bone resorption on the mesial wall of the socket. Bone apposition occurs on the distal wall, and this phase involves movements of the tooth to accommodate growing jaws, compensate for continued occlusal wear, and accommodate interproximal wear. These are the references. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Sunday or sometimes Thursday and Sunday also. We try to put MCQs according to topic on our shorts with the answers and explanation if needed, which will help you in Viva or NEET exam. Like, share and subscribe the channel. Thank you.